A good day to you. If you are tuned in, my name is Bridget Ndlovu from Women's Institute for Leadership Development. Last night, Tuesday 28 July 2020, WILD conducted a virtual meeting on the public opinion space focusing on the topic interrogating the leadership void in Zimbabwe's health sector amid the COVID-19 pandemic. Speakers at the online event were Jana Ncube, a trustee from the I Am for Bulawayo Fighting COVID-19, Dr. Begezela Ndlovu, a senior resident medical officer from Bilo Central Hospital, and Dr. Ruth Laborde, a member of parliament and the chairperson of the Portfolio Committee on Health. In this podcast, we present to you the different health issues they tackled. Let's hear from Dr. Ndlovu.
My name is Dr. Begezela Ndlovu. I'm an SRMO at Bilo Central Hospital. I would like to thank WILD for this opportunity, and also special mention to our honored guest presenters, Honorable Ruth Laborde and Jana Ncube. So I'm going to basically talk about how healthcare workers have been affected by COVID-19, and the major concerns have been on protection. I'll just go straight into it. Have been protection, the personal protective equipment, and the screening of even staff members and people who are entering the hospital. So you find that with personal protective equipment, the main challenges have been with the availability of the PPEs, which may be face masks in the form of surgical mask or N95 masks, and hazmat suits, those suits that you see people wearing there. So those have not been readily available, and in cases where they've been available, the challenge has been logistical in terms of getting the protective equipment to the relevant people who need the masks, who need the suits, especially maybe at different hours of the night or early in the morning. And so that has been an area of major concern, because that has left most of us healthcare workers at risk of being exposed to the disease. And also the screening, some of the screening, it becomes difficult because we are still allowing visitors, which creates a problem, because how do you not allow visitors when we also need them to buy medication, but at the same time they are also coming from communities where sometimes there's been exposure to COVID or public transportation, so they can carry COVID-19 to the patient, or they can take it actually from the patients maybe before they test positive or before the tests are done. So that is of concern. And also of concern is the inadequate intentional training and education of on-the-ground staff.
In his presentation, Dr. Ndlovu highlights that the unavailability of personal protective equipment for nurses and doctors is of major concern, as this is exposing healthcare workers to COVID-19. Now that we've heard the perspective of healthcare workers, let's find out what Jana Ncube had to say.
My name is Jana Ncube. I am one of the trustees and founding members of I Am for Bulawayo Fighting COVID-19. I Am for Bulawayo Fighting COVID-19 is a platform for citizens and people from all walks of life, from Bulawayo, people who love Bulawayo, people who care about Bulawayo and Zimbabwe in general. It's a platform that brings together experts, doctors, health and other health workers, brings together business people, the private sector, non-governmental organizations, and we decided to work together to augment the efforts of government and city council to deal with COVID-19 and help Bulawayo be ready to deal with COVID-19 and help also support our institutions and facilities in the city of Bulawayo be ready for COVID-19. One of the reasons actually we really had to do this was because the country's health infrastructure has really over the years not been up to standard. I think we have not seen levels of investments that are helpful to really keep our facilities having the latest equipment that is required, or even the buildings being maintained to the extent that you would say is really good enough. I think over the years we have seen the challenges that have existed with doctors and nurses and other health workers striking because of salary challenges. So one of the things that we really felt as a platform was to be able to see how we could augment these efforts and see if we could contribute towards this menace that I think is not only affecting Zimbabwe but the world as a whole. And with our facilities being in the state that they are in, and with this disease coming to land into our country, we really felt it was quite important that we stop apportioning blame to government or city council and take responsibility and take leadership to make sure that as citizens we just contribute to making sure that at the end of the day Bulawayo is able to deal with this challenge. Of course, it's really quite concerning that at the moment, while government has really put in place some really good efforts in having a national task force, even here in Bulawayo, with a provincial task force that's tackling a COVID-19, and I like that it's actually intersectoral, it's interministerial, that you have military and police there, because this issue is not only a health issue. While on the health aspects, that's the primary aspect. The secondary aspects that have to do with livelihoods, that have got to do with how we live in our communities, that have to do with the public being educated, really I feel is an important aspect. But of course, significant leadership is required from government, because ultimately the responsibility of ensuring that citizens rights and are well provided for lies with government. So yeah, it's quite concerning that at the moment you are not seeing instituted leadership that has been put in place. In a way, I think COVID has really shown the challenges that exist. I think with leadership generally across the world, we've had our health minister being moved. We do have gaps within the Ministry of Education, and even indeed some of the key hospitals in the country. So that is definitely something that is challenging, and that government really needs to prioritize to address. I'm really proud, though, that even in all of this, that the doctors and nurses and other healthcare workers continue to serve the public throughout this country and show up for work and provide the best care that they can. But they need to be supported by ensuring that these hospitals, these facilities have got the required personal protective equipment.
In her presentation, Jana Ncube acknowledges that the country's health system is not up to standard and points to that this realization led to the establishment of the I Am for Bulawayo Fighting COVID-19, a platform that brings together the public and private sector in order to augment efforts of the government in dealing with COVID-19. Having had these two presentations, now we will hear Dr. Laboda's views on the country's health sector.
I'm honored to actually have been included on this panel in this very important topic, COVID in the current health times. The COVID statistics have just increased rapidly, exponentially, that we are now not sure how far where we are going. But there's we are hoping that as we move towards the summer, as we move towards August, September, by nature and God's grace will control it. The numbers currently are sitting at 1,000, over 2,300. They are sitting over 2,300, and that's very high, considering the number of tests we are doing, because we are not doing what South Africa is doing. We are testing much less people than South Africa is, so we do not expect our numbers to be that high. But however, the question that keeps coming from people is that what should be done? What should be done to control COVID? COVID cannot be. I think the ministry has done everything within their means. They've been messaging the issue of this social distancing. They've spoken about masks, and they have successfully stopped the children from going back to school, which was, I think, was a big victory, that one. So what our challenge is currently, the question you would ask me is that, so why are people not social distancing? They are not social distancing because they are hungry. They are going out to look for food. And when they are looking for food, they don't care who they meet and who they don't meet, because it's either they are killed by COVID or they are killed by hunger. So what can be done then about this hunger business? I would propose that the Minister of Finance sets funding aside, especially for the urban poor, to ensure that they access at least a 10 kg bag of maize per family per week in towns. And then he can then revisit how he can manage the rural population, because the rural population tends to have some maize. But the urban population, once they have no maize, they will do whatever it takes, fighting for sales, fighting for anything. So the other issue actually that is worrisome, I keep hearing people saying the COVID is getting out of control because we have an acting PEMSEC, we have an acting minister. I don't believe that actually the acting part of it is the issue, because we had a full-fledged minister and the PEMSEC when we nearly lost, was it 60 million or 20 million? They were sitting in the offices when that happened, either pushed or forced to do so, we don't know. But all we know, from me, it tells me that even the acting PEMSEC, if he's got his integrity and he wants to really do the right thing, he can do it. He can do it. He can manage the system. And also, the issue of saying we need a minister. I don't think we necessarily need a minister. The ministry itself has systems. There's a director for disease control, director for SRH. All these directors are very competent people. If they come together and choose to work together under the acting PEMSEC, they will perform wonders. They will. I remember when I was a deputy superintendent for UBH some years ago, and Dr. Tarumbwa, we were just called medical superintendent. We were not called the COs. So when I heard Skosana has fired these COs, I thought it was a blessing in disguise, because he's saving money from the fiscus. Because I really don't know what different thing they can do. I believe the Director of Health Service can do this job. He can do it very, very well if he's determined to do it. So I'm of the opinion that COVID has nothing to do with acting minister or acting PEMSEC. It simply has to do with poor remuneration of doctors, poor health services for people, lack of medication in hospitals. So people are just frustrated. Doctors come in, and they have to think of their families. After 2 hours, they find a way of going to see one patient in town and then come back again. That's a life. And that never happened during my time, because we're well paid. And that's where we should be going now. We should be looking at those things. And it's a whole package, because it's a vicious circle. If you don't have medication, you have a demotivated health worker. You have nurses who are on strike, you have doctors who are on strike, and you say you need a minister. A minister to do what? To go and join the strike or something? Thank you very much. I'll wait for the questions.
Making her presentation, Honorable Dr. Laborde said poverty is resulting in a high number of people who are not practicing social distancing as they seek to fend for their families. During the discussion, Honorable Dr. Laborde implored the Ministry of Finance and Economic Development to set aside funding that will cater for underprivileged urban dwellers. She also made note that lack of a minister in the health ministry should not affect delivery of health services. With that said and done, the meeting attendees suggested that government should set up a social security scheme to support the needy during times of crisis. Thank you for taking your time to listen to this podcast, a podcast that discusses day-to-day issues that affect women. My name is Bridget Ndlovu, representing Women's Institute for Leadership Development.